Hey, you all. So, oftentimes we'll experience something and we just kind of overlook it or just mentally override it. And I wanted to bring you some information today that will help you to identify if you have some symptoms in relation or that are correlated to a deficiency in one of the B vitamins, and that's B1. And the reason why I wanted to cover this one is because, like I said previously, many of these B vitamins are depleted because of things that we do. We can have a depletion of it because it's not in the nutrients, but one of the things that makes a huge difference or impact on it are individuals that take in a high carb diet. And so it is something that's essential for our body. And when we don't have it, there are things that go wrong that we don't want to go wrong. So also there might be some things that you actually are taking in to help yourself that are causing this deficiency. And so I wanted to just make sure that you are aware of these things so that you can take action on feeling better. So I'm going to give you some things to look for as far as symptoms, responses in your body in relation to B1 deficiency. And so first of all, let's think about like our nerves, that sort of thing. We spoke about this before, having tingling in your fingers, peripheral neuropathy. So anything that has to do with the malfunction of our nerves. One of the symptoms is beriberi. You might have heard about that, and you'll have like muscle wasting, all sorts of other things taking place that have to do with that particular diagnosis. Your heart is not functioning properly, and so many other symptoms. But also, when we think about the B vitamins, this is something we mentioned as well before. I talked about our mental health, okay? So our mental health in relation to our physical brain. When we don't have certain nutrients, or when we're not getting enough rest, when these things aren't taking place and we're not receiving what we need, these are the outcomes that we get. And so one of those things that affects our brain, our neurological function, is the B1 very significantly. And so you can experience anxiety, overthinking, restless leg syndrome, POTS, insomnia, sleep apnea also related to that, a lack of energy. If it's hard for you to exercise and recover from exercise, like you'll move, but then your energy is not increasing, this is one of the things. Another side effect of it is vertigo. And this is something that's very common. I know individuals that take certain medications, and I just want to reinforce that the long-term usage, and they deplete your trace minerals, they deplete B vitamins. And so this is what I wanted to bring to your attention so you can counteract that and even hopefully make the changes you need to make in your lifestyle so you can avoid all of these issues here, which is always, great to have your quality of life that you should have. And another one is the digestive issues. Okay, so when in order for our digestive system to function, these nerves have to function, these muscles and the nerves, they have to function to perform peristalsis. So the stomach will start to churn this food. Well, you can get almost like a paralyzing of that. It's called gastroparesis. Gastroparesis is when this function is not taking place. And we need the function in order to break down the food and we can get the nutrients from what we're eating. These symptoms that we experience, they even affect our digestive system. So when it comes to something that's called peristalsis, our stomach these nerves and muscles, they're performing a movement in order to help push the food along and break it down. It's this whole system that takes place so our body can actually break down what we're taking in and distribute it to where it needs to go so that our body can continue to heal and recover as we're doing life, using our body, our brain, doing all of these things. And so B1 is necessary when you're taking in certain foods. Like when you're taking in the food, you want it to be processed, and for the part you don't need, to be done away with. But this whole process becomes less efficient because the food that you're eating is causing the deficit of the nutrient you need in order to process the food. So it's a horrible cycle. Now, the other part of that makes it detrimental is that you're getting the depletion of the nutrients you need to process it. But then you're also kind of hating on the other nutrients that still need to be processed because this vitamin isn't here. But on top of that, you then go take a PPI or a acid, something to reduce the acid in your stomach, which causes even more damage. It throws off the whole process, and so we'll get GERD and acid reflux. And the other thing is with breathing patterns. So you could even have maybe like a difficult, maybe it'll feel difficult for you to not catch your breath, but to take in air, almost like you can't take in enough air. This is one of the symptoms from having very low B1 or deficiency of B1. You could also have excessive sweating or not sweating enough. When you're looking to say, okay, I want to get healthy, but I'm gonna go work out, this is what I try to explain when it comes to getting healthier. Okay, if your focus is I'm going to lose weight, and I ask, how are you going to lose weight? And you say, oh, I'm going to go work out. So what about the nutrients you're taking in? What about the quote unquote food or things that you're ingesting? The workout cannot get rid of what's taking place in your body in relation to these things. If you're not getting it in, your body's at a deficit, you're taking in toxic food, you say, oh, I've seen t-shirts that say, oh, I run so that I can eat what I want. Or it doesn't work that way. Our bodies don't work that way. And so if you're eating in a manner that depletes this, or if you're on some sort of a medication that depletes this, and then you're saying, oh, the doctor said I got to get my weight down, and you're going and you're trying to push hard, you're going to feel worse. Because the more you're going on the medication and on that exercise routine, you don't feel better. And the goal is to feel better. And so you see how it produces this cycle. You need energy to exercise. You're not exercising so you can burn it off, get rid of it. No, your body needs specific things in order to be able to function. So in order to walk, you need B vitamins. Why? Because the nerves, they need to be able to send the communication throughout your body to perform it. And you need that energy. You need the energy to do the exercise. Okay. So exercise is not about burning calories. No, it's not. Exercise is about improving the function of your body, which changes season to season. You might have one season where you're sitting down more. Well, you got to make an adjustment. You might have one season where you're playing a competitive sport. That doesn't mean you don't, oh, that's my exercise. No, playing basketball, running, tennis, that's not what I'm speaking of when I'm saying exercise. If you change and do things like that, then that means the exercises that you do, they change to support that. You see what I'm saying? They change to support what your body needs in regards to your hormones. Because another thing, ladies, is that when you think you're going to push hard, you're causing yourself to store more fat. And you've probably experienced this. You work out harder and you're still puffy. There hasn't been a change that's taken place, and you might even gain weight. So you're moving and your body's saying, oh, because I'm moving, now I need more of this. So then your appetite will crave something that you're familiar to, which might be unhealthy, and the same thing that's causing the outcome that you're in at that point. And then it has this whole cycle. You see what I'm saying? You're moving more. I want more of this. You have more. No, I can't eat that because I got to cut my calories and I have to eat less and I have to move more. It doesn't work like that. Remember, I can't reinforce enough. It's about nutrients. It's not about calories. It's not about calories. It's about what is inside of those calories. And so I want you to really think about this and consider these things because, like I said, why not prevent a headache that you don't have to have? There's plenty of headaches that are going to be thrown at you. Why not allow this to be one? And so this is really good news because you can actually take action on this one. You know what I mean? It doesn't take some complicated procedure. I mean, there's some individuals that get surgery and all they need is to give their bodies the nutrients in order to regenerate itself. I would rather take in the proper food and vitamins for a period of time so that my body can get to the point to where it can function the way it's supposed to properly function. And now let's talk about who might be at risk. And so if you're consuming a lot of carbs, like I said before, if you consume alcohol, you're definitely going to have issues there. Matter of fact, if you have fatty liver, whether it's alcohol induced or the one that's most common, which is non-alcoholic fatty liver disease here in the U.S., it's on the rise because of the high sugar content of food that we eat. We have sugar hidden in everything. So that can cause a B1 deficiency. Alcohol consumption can cause a B1 deficiency and diabetics. And for many individuals, it's recommended that they take B1. in the form of benfotiamine, which I'll talk about a little bit in a moment. But if you're diabetic, if you're insulin resistant, which is the root cause of many of the issues that we have, like Alzheimer's, any one of these diagnoses, then you're at risk of having a B1 deficiency. Ketoacidosis is one of the side effects of taking the medication for diabetes. Another one is other, prescription medications. There's also, if you've had a gastric bypass, your stomach cannot absorb these nutrients that you need in order to stay alive. Why sometimes if a person have had gastric bypass or maybe even taken the fat loss injections, you're going to be weak. Your stomach can't process the nutrients, it can't absorb it with those injections, and so your energy is coming down and you're losing muscle. When you lose weight, you want to lose primarily body fat. You don't want large percentages of muscle and weakening your bones by not having this, okay? But if you've had any sort of gastric bypass or any of the injections, you're also at risk of having a deficiency of B1. Also, if you drink a lot of coffee or tea, anything with caffeine, or maybe those energy drinks, which they're not energy drinks, you're going to be depleted of this. They don't give you energy. They don't give you energy. Work with the function of your body to give you energy. And so that's why many times individuals will say, oh, I have more when I take my B vitamins. I feel like I have more energy. Yeah, because your body can now produce the energy that's necessary in a number of different ways. Also, there are certain vaccines that also trigger B1 deficiency. And this is where a lot of the then diagnosis from individuals that have taken some are coming, these diagnoses that have to do with neurological diseases. Some of them have caused like inflammation in the brain, and that damage is taking place and causing these diagnoses. So now you can take in or get in more B1 by taking in nutritional yeast, but you want to get unfortified nutritional yeast. It has all of the full complex of B vitamins. I like to put it inside my eggs. It's a great substitute for those of you that don't want to eat dairy. It has like a cheesy flavor when you put it in there. And like when you're scrambling them or when you're, cracking them, you just sprinkle that in there, however you want to cook it. But it does have a cheesy flavor. So that's one way that you can have it really easy. A lot of people eat eggs in the morning. Another way, actually with pasture-raised eggs, so you want to get the organic pasture-raised eggs, go to your local farmer's market. They have the B vitamins in there. Organic grass-fed liver, and the reason why it's organic grass-fed, because what they're given is different. They're not given like fake corn, which causes inflammation in the body, and then we're taking that into ourselves. And then they're also not getting the pesticides that are sprayed on that, which, remember, the liver, it's a detoxifier. So if it's helping to detox, a lot of those toxins will be in the liver. And so you don't want to eat like conventional liver. Wanting to get these nutrients, you want to get an animal that was raised the way that it was originally designed to raise and get its food. That's going to be the best kind. But you get the right kind and it is going to be very, very beneficial. And so, like I said, these illnesses, neurological diseases like Parkinson's, Alzheimer's, peripheral neuropathy, that's kind of one of the side effects of the deficiency. A lot of people who are diabetic, they experience this. These are all issues with the nerve. Inflammation in the body, or maybe damage that was done. The nerves are damaged in some way. One of the best forms of B vitamin that you can take is going to be the benfotiamine. It's a fat-soluble B vitamin, form of a B vitamin, and it's been proven to work really well with these neurological illnesses or diagnoses. So B vitamin. Now, the other thing is that you want to make sure that you still take it with the complex. So you can get the benfotiamine on its own, and whatever dosage that you're going to take is probably a little bit higher than the other ones. And then you can every day eat nutritional yeast, or every day take a good quality B vitamin complex. Okay. All right, you all. So I hope that was helpful, and I'll talk to you all soon.